This is Dr. Megan Flynn presenting an intra and extracapsular decompression of a subspine on a patient with a large anterior inferior iliac spine. Below are our disclosures. For orientation, we are operating on a left hip, viewing from the 12 o'clock portal and utilizing a combination of the mid-anterior and dala portals for our working portals. So while in the central compartment, utilizing the bird's eye view, the burr is utilized to debride and decompress. The intracapsular care is taken to avoid debriding and injuring the capsule. Once you have reached the extent of the ability to decompress intracapsularly, you will then proceed to the extracapsular decompression, first using a shaver to dissect above the indirect head of the rectus femoris with a shaver blade facing the tendon of the indirect head and working superiorly, elevating the muscle off the tendon as you see here in order to get to the subspine area. See, we're sort of making our way to the soft spot between the direct and indirect heads of the rectus femoris. Your shaver blade should essentially fall into the site between the direct and indirect heads, which we see here. At that point, you'll take an x-ray to ensure you're in the right spot, so fluoroscopic views, utilizing the shaver to fully skeletonize the subspine and making sure to use fluoroscopic guidance as you continue to skeletonize. Once the subspine has been skeletonized, we then utilize a wand, electrocautery device to debride the area directly above the subspine, preparing it for decompression and debridement with a burr. You can see on the left-hand side of the screen here that we have made it to the previous resection that was intracapsular. So then you'll shift from a wand to a burr, and starting from the previous intracapsular resection, you then utilize the burr to resect the extracapsular subspine. While resecting, it'll be important to take fluoroscopic images to ensure no over or under resection takes place. As you continue to resect, taking fluoroscopic images to evaluate the resection. Also intermittently evaluating both the direct and indirect heads of the rectus to ensure those have not been violated. Once you have completed a resection, you will obtain final x-rays, making sure to also obtain final arthroscopic images. And here you can see pre-resection and post-resection of an intra and extracapsular subspine.